My name is Tolbert Nyenswah, a senior research associate in the Department of International Health at the Johns Hopkins Blueberry School of Public Health in Baltimore, the United States of America. Before joining the Johns Hopkins University, I was the incident manager responsible for the incident management system for the 2014-2016 Ebola outbreak in West Africa, specifically in Liberia. Teaching this course, I will focus on the module I have to do with crowdsourcing, surveillance, and incident management system, crisis intelligence course. It's a privilege to introduce this course and the importance of crowdsourcing. Surveillance is one of the core elements of running a public health crisis. If you have a public health crisis, getting the intelligence, the cluster of causes, systematic collections, analysis, correlation of data, monitoring of cases, tracing their contacts, testing them, and reporting is what the surveillance system will look like. And that's the core of any crisis management in a public health system. You have to get the surveillance right, the data collection right, then you can trace the cases. That's the basic component of surveillance. I know everybody knows what Ebola is, one of the later diseases transmitted from person to person. Liberia was engulfed and struck in 2014, the early part of 2014, with an Ebola outbreak, very unprecedented. And the reason it's unprecedented, it was in 3 capital cities across borders with thousands of cases that were reported. Before the outbreak was declared over, there were 28,000 cases with 11,000 deaths in West Africa alone and other areas. It's impacted the health system and the economy. So Ebola was really, really devastating. We had to organize an incident management system. The challenges were organizing the IMS system, getting the coordination team together. Laboratory testing was challenging. We had to transport samples, managing the dead bodies, community engagement, and information sharing were the major challenge. And these things collapsed the healthcare system of the 3 countries, Guinea, Liberia, and Sierra Leone. The incident management system, there's a difference between the incident management command and incident management system. Incident management system encompasses not only health response, but brings together logistics management, information management, data management, and providing the equipment to do the work. So the incident management system that I headed in Liberia in West Africa was comprised of the epidemiology system that you have to put together to collect the data. And this is why crowdsourcing is important in surveillance system. Contact tracing team have to be there as part of the pillar. You have to put a laboratory team that collect the specimen from the patient. Social mobilization is very, very key. And cases management in isolation unit, because in Ebola, you have to put the cases in isolation in the Ebola treatment unit, and making sure that you have the specialized staff in ambulance system, treatment management, psychosocial support, barriers of the dead body, internal control system, information collection, all of that, and logistics. All of these are important in the incident management system, patient isolation, case management, and having the monitor the epidemiological trend, and the weekly reporting, information sharing with the community makes incident management system an important tool, public health tools with crisis management and outbreaks. Oh, data collection was at every level of the incident management system. You have to get data from the Ebola treatment units to know the number of cases, the case count. You have to make sure that the laboratory information system was up to date to get testing that was done in a lab, and the data have to be accurate. The contact tracers have to go into every cluster of the outbreak in the communities to get people who are contacts. And if the contact develops symptoms, you have to make sure you get the specimen and put it in the lab. And then you have to make sure that the epidemic curve is monitored to know when the curve is flattening and which communities are reporting disease. That's where the information collection and sharing is important. It drives on how the incident management system runs and how you can get ahead of the curve of the disease and make sure the outbreak gets under control. That's why surveillance system and data collection is very, very important. These are the sources of data that you have to get and monitor and process to make accurate decisions for the outbreak. First, the surveillance system have to have trained people. And this is where field epidemiologists play a very, very crucial role. Field epidemiologists, what we dealt with in West Africa, every district and community had cases of Ebola in the community. So we had to use the field epidemiologists that are trained to collect the data. That information is important. Once you know where the cases are, then you can isolate them. So the role of surveillance system is core to everything in the outbreak. That's how you get the decisions for contact tracing. That's how you make the decisions of who to isolate in the treatment unit. That's how you make the decision of what kind of logistics and PPEs that are needed in the Ebola treatment unit. That's how it helped the ministry to curtail the disease in 2014, 2016. Yes, I know there were cases in some of the communities that were resistant, and we divided the country into counties and zonal reporting. We got to know that there were less cases, or the cases were declining in some of the counties that we were dealing with, and the capital city of Monrovia were reporting more cases based on the surveillance information that we were having. It makes me, as the incident manager, based on the clusters, to focus more attention on logistics management, on the number of people we needed to deploy, the number of PPEs we need to procure and put into action, and divided the response, separated the response with strong community mobilization and community engagement in Monrovia, where the disease was concentrated, and providing diseases and other infection to other counties that were Ebola free. And I'm seeing similarity in COVID-19 today. The situation is similar because we're dealing with infection that's spreading from human to human. That's one similarity. It is spreading from one area to another area. This one is a pandemic. That makes it a little bit different. Ebola was not a pandemic. It was a cluster in West Africa, but there were few cases that were transported to the United States, Europe, and other areas. Other similarity is you have to do the same traditional public health measures that you did in Ebola to contain COVID-19, meaning contact tracing is important. Testing is important, making sure that all probable and suspected cases are 100% tested. That's why we did in Ebola. When we got ahead of the disease, it was testing, and isolating the patients. These are the similarity I see in COVID-19 today. The dissimilarity is that the case fatality rate is a bit different. For those of you who may not know what case fatality rate is the number of infection plus the number of persons that will die from the infection. With Ebola, it had very high case fatality rate. Before WHO declared the disease over in 2016, it was 40%, sorry. It was 40% case fatality rate as compared to COVID-19 that is still around 2% to 3% case fatality rate. So the number of people dying from COVID-19 is different from the number of people that were dying from Ebola. But all of the measures that you're supposed to take are the same. Get the sick people, test them, get their contact, trace the contact 100%, isolate the contacts. That's how you respond to a disease that is spreading widely like the COVID-19 that we're looking at. And PPEs are very, very much important. In West Africa, we lost 192 healthcare workers in Liberia alone. In the entire region, about 300 health workers lost their life. I'm seeing similar situation in COVID-19 when healthcare workers are getting infected in the United States, in Europe, Italy, Spain, in China, where the disease started from. And so protecting healthcare workers with the right PPEs is very, very, very critical. When the healthcare workers are infected, they will desert the healthcare system. And you wouldn't want that. That's happening in West Africa. You have to know where the disease is to respond. So getting the information in the crowdsourcing and making sure that you test the cases in the communities is very, very much, is a panacea, if I may say, to getting an outbreak under control. If you cannot do a well surveillance system, you are in trouble. And this is why the curve for COVID-19 has not been flattened yet in places like Europe and the United States. So getting surveillance system from crowdsourcing, crisis management, crisis intelligence is important. It should be a part of the incident management system. The incident management system brings together all of the pieces that I was telling you about: epi surveillance, contact tracing, laboratory, etc. And crowdsourcing and getting the cases from the communities is very, very much critical. It should be stood up from the very beginning of an outbreak, followed by testing. You must have isolation facility available to do crowdsourcing surveillance. The reason is the cases that you are detecting through a surveillance system must go into isolation and they should be treated. And so they go hand in hand. As you establish the treatment units, you also establish the crowdsourcing surveillance system. Finding the cases is one thing, isolating them and treating them is another thing. You break transmission when you isolate the cases. When the cases are still in the community, human-to-human transmission will continue. Number one is getting the testing right. Laboratory system is a challenge. You should get those in place first. From an experience, that's one of the major crucial challenges we had. We had to take cases and specimen from Monrovia through the border in Guinea, which is a lot of about 1,000 kilometers. And you get the results taken to another laboratory elsewhere. So the testing capacity wasn't there to improve the surveillance system. That was a major challenge. To alleviate that, you must have the laboratory test and make sure that the specimen is taken to the lab and the contacts are traced very, very fast to get ahead of the outbreak. What we see in COVID-19 is the testing are delayed, and when those kind of challenges happen, you cannot get ahead of the curve. The disease will flourish, and the exponential increase of the disease, you will see it in communities and in big cities. That's why we are countering right now. So my advice to countries, communities, and cities and states that are facing COVID-19 right now, make sure your testing capacity is there, get areas to isolate the cases, and then you will have a very strong surveillance system and information sharing. One of the important thing that we also need to know in a crowdsourcing and surveillance system is to do self-isolation and self-quarantining for people who are suspected or probable of having a disease. I will give thermometers into households and communities with contacts so that do self-reporting of their temperatures. That's part of a surveillance system. If somebody is getting symptomatic, they report their symptoms immediately. You get an ambulance to a health facility and get the person into isolation, and the rest of the people in the house, you make sure that everybody is self-isolated. With that, you get ahead of the disease, and the disease is not transmitted in the population. So the challenges can be overcome when you have your testing capacity, your isolation facilities, your household are aware of the treatment of the disease and can report the cases on time. So colleagues, thank you for listening. It is an important measure for this course. It's an important course that crowdsourcing and surveillance in crisis intelligence is very, very much important. I'm Tolbert Nyenswah, a senior research associate at the Johns Hopkins Bloomberg School of Public Health, someone who headed the Ebola crisis in West Africa, the conglomeration of international responders. So this course is an important course. I would like to take you to a website, www.cdc.gov. That's www.cdc.gov. There is a paper that was published called Ebola Crisis Management. And I can send you the website later on so that you get hold of that and you can know how an incident management and crisis management system is set up.